Hi, everyone. My name is Kaur Cicero, and I'm from Columbia University Medical Center in New York. I want to thank the International Myeloma Foundation for inviting me today to speak about our abstract and poster on the impact of Hispanic ethnicity on disease characteristics in multiple myeloma. So to jump into the background, so it's really great that there's been such a national drive to improve outcomes and access to cancer care in minorities. We are becoming increasingly more aware of the racial disparities in multiple myeloma between those of African descent and whites, demonstrating one of the most substantial disparities in incidence of any hematologic malignancy, as well as some differences in disease characteristics too. However, there's still a paucity of data on other racial or ethnic minorities, such as Hispanics. There was a single institute study in New York that evaluated almost 1,000 patients with multiple myeloma, 30% of whom were Hispanic, and found that compared to non-Hispanic Black and non-Hispanic white patients with multiple myeloma, Hispanics had a higher proportion of early-stage disease, did not differ by cytogenetic abnormalities, and had better overall survival with equal access to treatment. But this cohort included those diagnosed anywhere from 2000 to 2017. Cytogenetic abnormalities evaluated during this time only included p53 deletions, diploidy status, translocations T414, 1416, and 1114. Furthermore, the treatment landscape for multiple myeloma has drastically advanced over the past couple of decades, so these conclusions may not be relevant in the current era. Other studies evaluating Hispanics more so focused on resource utilization and access to care, rather than disease characteristics specifically. So to our knowledge, no study has characterized the biology and clinical outcomes of Hispanics with multiple myeloma since 2018. So we performed a retrospective cohort study of all patients newly diagnosed with multiple myeloma from 2018 through 2021 at Columbia University Medical Center to determine if Hispanics differed from non-Hispanics in terms of clinical characteristics and outcomes. As those of you familiar with New York will know, Columbia is situated in Washington Heights, which is a neighborhood comprised predominantly of individuals of Dominican ancestry. A large proportion of our patients, therefore, self-identify as Hispanic. So from 2018 through 2021, 201 patients were newly diagnosed with multiple myeloma, 38% of whom self-identified as Hispanic. Among the 125 patients who were not Hispanic, 52% were non-Hispanic white, 35% were non-Hispanic Black, 11% were Asian or Pacific Islander, and 2% were other or unknown. And so what we found was that Hispanics did not differ from non-Hispanics in terms of age at diagnosis, proportion of light chain myeloma, hypercalcemia at diagnosis, or renal insufficiency at diagnosis. Both ISS and RISS stages at presentation were comparable between ethnicities. Notably, however, Hispanics had a more than 2.5-fold higher incidence of deletion 1p compared to non-Hispanics, which was statistically significant. And this led to significantly greater odds of harboring expanded high-risk cytogenetics by FISH. Additionally, we found that Hispanics had fewer T1114 translocations compared to non-Hispanics. When looking at the induction regimens used from 2018 through 2021, we found that VRD was most commonly used, followed by DARA VRD and then BCD. The other category encompasses regimens that were used in less than 5% of cases each. And so in terms of upfront high-dose melphalan autologous stem cell transplant, it was performed in 36% of Hispanics versus 41% of non-Hispanics, but this was not a statistically significant difference. And now looking at the Kaplan-Meier curve, we see that the median progression-free survival of Hispanics was about 30 months compared to about 38 months in non-Hispanics. And this was not statistically significant. So what does all this mean when thinking about the clinical significance of our findings? Well, deletion 1p has been validated as an adverse prognostic marker in multiple myeloma. There was actually an abstract presented during ASH this year that showed that after adjustment for age and treatment, patients with deletion 1p had a 1.3-fold increased risk for progression and a 1.9-fold increased risk for death. So the significant increase in deletion 1p amongst Hispanics seen here may actually translate into decreased progression-free survival, a trend observed here as well. But longer follow-up with more patients is needed. So ultimately, deletion 1p should be assessed within myeloma cytogenetic panels, and perhaps risk-adapted treatment strategies will allow for improved outcomes for Hispanic patients with multiple myeloma. And with that, I want to thank you for listening, and also thank my mentor on this project, Dr. Raj Chakraborty. Thank you.